Assalamualaikum. My name is Dr. Danish Kumar. I am from Department of Hepatogastroenterology, SIUT. Today I am going to present the topic of comparison of diagnostic accuracy of plasma lactate and ascitic fluid lactate in predicting 1 month mortality in patients having spontaneous bacterial peritonitis. The mortality associated with spontaneous bacterial peritonitis is 20 to 40% in hospitalized patients despite appropriate antibiotic therapy. Ascitic fluid lactate level have previously been utilized for the diagnosis of SBP. Previously, data is scarce regarding the utility of ascitic fluid lactate in predicting mortality in SBP patients. Therefore, our aim was to compare the diagnostic accuracy of ascitic fluid lactate and plasma lactate in predicting 1 month mortality in SBP patients. It was a prospective cohort study which was conducted at the Department of Hepatogastroenterology, SIUT from 1st June 2021 to 31st November 2021. All the cirrhotic patients diagnosed with SBP were included in the study. Patients with a history of ischemic heart disease, peritoneal hemodialysis or having other infections such as UTI, fungal infections or HIV infection were excluded from the study. Baseline characteristics were recorded. Continuous variables were expressed as mean and standard deviation, while categorical variables were expressed as frequencies and percentages. Continuous variables were analyzed using student t-test, while categorical variables were analyzed using chi-square test. Primary outcome was 1 month mortality. Area under the receiver operating curve was obtained for ascitic fluid lactate and plasma lactate in predicting 1 month mortality in SBP patients, followed by calculation of sensitivity, specificity and diagnostic accuracy. So total of 65 patients were included in the study. Among them, 48 patients were male, and most common cause of chronic liver disease was hepatitis C, seen in 22 patients, followed by hepatitis B in 16 patients. Out of 65 patients, 50 patients had child class C at the time of admission, and most common organism seen in ascitic fluid culture was E. coli, which was seen in 12 patients. 17 patients died within 1 month. Area under the receiver operating characteristic curve for ascitic fluid lactate was 0.793, which was slightly higher than that of the plasma lactate, which was 0.73. At an ascitic fluid lactate level of 19 or more than 19 mg per deciliter, the sensitivity, specificity and diagnostic accuracy was 81.25%, 84.8% and 83.1% respectively. At a plasma lactate level of more than or equal to 13 mg per deciliter, the sensitivity, specificity and diagnostic accuracy was 78.1, 81.8 and 80% respectively in predicting 1 month mortality in patients with SBP. So this is a figure showing the area under the curve for ascitic fluid lactate and plasma lactate. So this table is showing the comparison of the diagnostic accuracy of ascitic fluid lactate and arterial lactate in predicting 1 month mortality. So we can conclude that ascitic fluid lactate more than or equal to 19 mg per deciliter had a better sensitivity, specificity and diagnostic accuracy in predicting 1 month mortality in patients with SBP as compared to plasma lactate levels. Thank you.
Thank you very much.